Hi there, Anil Basnet, nursing student, and I'm going to do pain, neurological, and respiratory assessment. Let's start with your vitals. Your temperature is 39.7 degrees Celsius, heart rate 115 beat per minute, respiratory rate 22, and your blood pressure 115/70. Your heart rate and temperature is slightly elevated. That is a sign of fever, and your body working hard, possibly fighting against infection. Your respiratory rate is little higher than normal related to your chest tightness or fever. We'll monitor you closely and notify the healthcare team. Now I'm going to ask you a few questions related to your symptoms. You have mentioned you are having a headache. Can you explain more?
Yes, and my neck is really stiff.
Have you experienced any tremor or shaking?
No.
Any recent seizure activity?
No.
Any numbness and tingling around the body?
No.
Any vertigo or dizziness?
Yeah, I feel dizzy and it's making me nauseous.
Any sign of muscles weakness for leg or arms?
No.
Do you have any difficulty in swallowing and speaking?
No.
Do you have any recent head injury?
No.
Do you have any shortness of breath or difficulty in breathing?
No.
Do you have any cough?
Yeah, I have a cough, but it's not too bad.
Is it productive?
No.
Do you have any pain while breathing?
No, but my chest hurts a little.
Do you have any allergies?
Yes, insulin.
Do you have any medication?
Insulin.
Okay, now I'm going to do your pain assessment for your headache using OPQRSTU. When did it begin?
One day ago, worse today.
What make it worse?
Moving in lights.
What helps?
Falling asleep.
How do you feel?
It feels like throbbing.
Where did it located?
All over my head.
Does it stay in one place or it goes move around?
It doesn't spread. I just feel tired and dizzy.
On the scale of 0 to 10, when 0 being no pain and 10 being the maximum pain, how do you rate your pain?
8 out of 10.
Have you tried something to relieve pain?
I tried to take Tylenol and Advil, but it didn't work.
So when did it start? It start there or it comes and goes?
It's all the time.
What do you think it's causing your headache?
I don't know, I just feel so sick.
Since the over-the-counter medication like Tylenol and Advil is not working on you, I'll notify healthcare team to provide you strong analgesic. In the meantime, we will maintain your hydration and monitor your blood glucose. And since you mentioned sleeping and darkness will help, we'll try that one too. Based upon my physical infection, you look tired and fluffy, most probably because of your fever. You are alert and oriented time 3, that is very good. No visible sign of tremors or tics and muscle weakness. You seems like move normally, no sign of rigidity or paralysis. Your breathing is very normal, non-labor, normal, and without using any accessory muscles. Now let's do your neurological assessment. For your Glasgow Coma scale, your eye opening, you open your eyes on my voice, scoring 3. Your verbal response, you are orientated and you are answering my question properly, scoring 5. Your motor response, you are obeying my command, scoring 6. So your total score is 14 out of 15. And to do the pearl, your pupils are round, equal and reactive to light. Let's do the motor strength. Squeeze my hand, fingers, they are strong and equal. Push against my leg, my hand, bilaterally strong. This is very good. Now I'm going to aspirate the lungs. Listen to your lungs. For that you have to sit up. And I need to do the zigzag motions, side by side, in between the rib, from second intercostal space to sixth intercostal space in mid-clavicular region for the anterior, and for posterior I will have to do between C7 to T10 vertebrae, and I have to listen fully for inspiration and expiration. So listening to there is a breath sound present bilaterally, clear, without any wheezes or crackle. However, based upon your symptoms, we will be monitoring for the crackle, that's a fluid in your lungs, or wheezes, that's narrowing your obstructing your airway. Now to the S bar. Situation is this is a 17 years old male patient presenting with headache, fever, stiff neck and dizziness. Background, he has a type 1 poorly managed type 1 diabetes with the symptoms headache 8 out of 10, nausea, dizziness and mild non-productive cough. No sign of tremors, tics or changes in visual. Assessment, for the assessment part, vital sign shows some fever, tachycardia and tachypnea. Neurological assessment, GSE is 14, PUL and with no motor deficit. For respiratory assessment, respiration is normal, no visible sign of respiratory distress. For the recommendation, the patient is supposed to be assessed by the MD or NP urgently. In the meantime, comfort measures such as antibiotic and close monitoring of blood glucose should be initiated immediately. For the critical thinking part, possibly meningitis or systemic infection based upon the symptoms present such as headache, fever, stiff neck and dizziness, especially for the type 1 diabetes patient who are already immunocompromised. Two nursing intervention right at this moment will be frequently monitoring vital signs and neuroassess. There is a risk of neurological deterioration and closely monitoring blood glucose because fever and infection can cause further complication in type 1 diabetes such as DKA. Two doctor order I am expecting is CBC blood culture and lumbar puncture for investigating meningitis or infection, and IV antibiotics and fluid for infection or hydration. Thank you.